Welcome to Healthy Frontiers. Our show is dedicated to the education of our viewers. Tonight's show is a really great one. We're speaking about keeping million-dollar ball players on the field. And my special guest here is Steve Donohue. Steve Donohue is a consummate professional and has been an athletic trainer with the New York Yankees for over 20 years. He has a lovely wife, Paula. He has two beautiful children, Meg and Shannon. And he's been a good friend and a colleague for many years. He's also got 4 World Series rings, so we know we're talking to a pro. So welcome, Steve.
Thanks, Doctor. Thank you very much. Pleasure to be here.
Oh, it's my pleasure to have you, really. Steve, tell me, you're an athletic trainer. Tell me about athletic training and how it may differ from a personal trainer, and what is an athletic trainer?
Well, an athletic trainer is someone who works with people or a team and to try and prevent, treat, and rehabilitate injuries. And it's different from a personal trainer. A lot of people say the trainer. Yeah. Well, a personal trainer is someone who works with one individual, one-on-one, usually in a gym to help the strength and conditioning aspect of somebody. Whereas an athletic trainer can work one-on-one, but really more for the injury side. We take care really of the injuries, and like I said, the treatment and rehab and prevention of injuries. It can constitute a little bit of the conditioning and strength too.
Yes.
But a personal trainer is really almost a gym person to work on that.
One-on-one.
Right.
Okay. And where do athletic trainers work? I mean, I know you work for the Yankees, and that's...
There's all different settings. And one more thing about the personal versus the athletic trainer I want to bring up is to be an athletic trainer, you have to be certified by a National Athletic Trainers Association.
Okay.
Whereas a personal trainer it's a whole different conditioning and a whole different board.
You don't need to be certified by the same group.
Right.
Okay.
As far as athletic trainers settings go, I'm in a professional level,
Yes.
and there's also athletic trainers at the university and college level,
Right.
high school level, more and more, and that's something that the National Athletic Trainers Association is trying to push for more and more high school athletic trainers, because here's kids at young ages with, where their growth plates and where they're just starting to their bodies are just starting to mature.
Yes.
And a lot of high schools don't have an athletic trainer, and it's a dangerous setting, with football and lacrosse and basketball and baseball and everything that they're playing. There's more also athletic trainers in the clinic settings now.
Right.
There's athletic trainers in corporations, like IBM has athletic trainers. Even different settings that you wouldn't expect, like the Rockettes at Radio City Music Hall have an athletic trainer. That's right.
Isn't that amazing? Wow. So it's worldwide and it's all over.
That's right. It really is.
Okay. And how did you become an athletic trainer?
Well, when I was in high school, my first thought was that I wanted to be a coach. I wanted to get into, especially I was especially interested in football as a high school student, and but our counselors at an alma mater that we both know at Cardinal Spellman High School.
Cardinal Spellman, that's both alma maters.
They kind of veered the students there away from coaching, and they thought, you could do something in athletics, but that's not a very stable position.
Yes.
So I got into the idea of physical therapy, and so I started volunteering in Mount Vernon, New York, at the Mount Vernon Hospital in the physical therapy department 1 day a week.
Yes.
And enjoyed it, and decided to try and put the two things together: physical therapy and athletics.
Yes.
And athletic training is where I came out.
Right.
So I did that. I was very fortunate to meet the head trainer for the New York Jets. His name was Jeff Snedeker.
Okay.
And he invited me to come to out to Hofstra, where their training camp was, and become part of the Bucket Brigade, which is basically water boy, making the Gatorade, filling the whirlpools, making ice bags. And he was great to me and really taught me a lot and showed me a lot, and I learned how to tape and do more treatments and started doing more in the training room.
More on-field stuff.
And on the field, more on-field stuff. And so that developed, and then I got a scholarship to the University of Louisville and as an athletic trainer.
Okay.
And so I worked there for football and basketball and baseball. And then while I was at Louisville and still working in the summer times with the Jets, a friend of mine who was in the PR department went to the Yankees as the head PR man. He called me while I was still at school and said, a job's opened up in AA at West Haven, Connecticut, our AA affiliate.
Right.
Would you be interested? I said, oh, that'd be great.
Well, wouldn't it be?
And yeah, sure. So I went to I went to school in the fall semester, and in the spring I'd go to spring training and then work the summers for the Yankee minor leagues, and that's what I did until I finished school.
Great.
So
then on to New York Yankees.
And then, well, after 7 years in the minor leagues, on to
7
New York.
years.
Yes,
Okay,
yes,
so you paid your dues, certainly.
I paid my dues.
There
Yes,
you
sir.
go.
Just like the players.
Worked
your way up.
Worked your way up. Okay, so how many athletic trainers are on the Yankees? Are you the only one, or is there someone else?
Well, there's two of us, Gene Monahan
Gene.
and myself in New York, and then we have about 8 minor league trainers.
Okay.
You know, athletic trainers at every facility in our minor league teams.
Around the country where you
Right,
have
all
different
around
teams.
yes, sir.
Okay, so they make sure those trainers are in place.
That's right.
Okay, and so tell me, I think the viewers would be really interested in knowing what's a normal day at Yankee Stadium for you. Is there a normal day?
There's never a normal day at Yankee Stadium. Every day has got its own special situation.
Okay.
But I get to the stadium for a night game about 1 o'clock in the afternoon for a 7:30 start, or a 7 o'clock start.
Yes.
And you know, the beginning of the day is all setting up. You know, we filling basically what I did when I was a kid, filling the whirlpools,
Right.
making the Gatorade, getting all the water, the coolers ready, getting the wraps all rolled up,
Right.
getting ready for the players to come in. Then our injured players start arriving right around 3 o'clock.
Okay.
And we have all the injured players come in earlier,
Right.
so they can get their treatments, get taken care of, and then we can get an idea of their status for the game that night.
Sure.
So we start our treatments right around 3 o'clock, and then batting practice starts around 5. We
Okay.
go out for stretching at about 10 to 5.
Mm-hmm.
So so then we go out for the team goes out. We do our treatments up till then. They go
Right.
out for stretching and batting practice, and they come back in after infield, and then it's our last minute preps. You know,
Right.
the last
Tapings,
minute tape
et cetera.
jobs, getting the
Yep.
wrist tape, getting the ankles, whatever's stretching.
Right.
We do some extra stretching on a few players. You know, Derek is a real big hamstring stretch guy. So right before the game, like 5 minutes before the game, he wants to get on the table and get his hamstrings and low back all stretched out right before he
Okay.
goes. So
Right.
we do all that stuff, and then 7:05 we get the game started, and then we're covering the game. And there's 2 of us, so usually like the first 3 innings, Gene's out in the dugout, and I'm
Right.
inside getting the bullpen guys ready.
Okay.
The bullpen pitchers,
Mhm.
they don't have to be out right away. A few of them, I mean, some of them have to be out right at the game starts, but like Mariano and a few of the setup men
Yes.
can be a little bit later, go out after a couple innings.
Okay.
So we'll
So
have
we know they're not going to be until later.
right till later in the
innings.
game.
Yeah.
So they'll come in and they'll get their hot packs and get their analgesics
Right.
and get stuff ready. So the
Okay.
first 3 innings I do that. Then Gene comes back in. I go out for the middle 3 innings, 4, 5, and 6 innings.
Right.
And then at the end I come back in for 7, 8, 9 because I'm icing players, guys that are coming out of the game that are getting ice or have any problems.
Sure.
Come in and so then the game ends. Then we have a lot of cryotherapy. There's all ice on everybody. It
Sure.
feels like.
That's right.
And then it's after showers. You know, any wounds or any abrasions or any strawberries that have to be patched up for the
Right.
For the night.
So you're there pretty late after
Yeah,
the
oh
game.
yeah. So then it could be 1 to 1. It
Yeah.
could be 1
So it's a
1
long day.
p.m. to 1 a.m.
It's
That's
a
right.
commitment,
It could
sure. And so, what are some of the modalities you might use while you're in the training room?
Well, we have ultrasound machine. A lot of the same modalities that you use in your office.
Okay.
But we use ultrasound machine, which is a deep heat, deep ultrasound waves.
Now,
to
what
get
exactly is that ultrasound?
Well, ultrasound is a deep heating that gets heat in deeper into the muscle
yes.
than just a
heat pad
A
or
heating
so.
pad. But
Okay.
we use hydroculator packs, which are
Right.
heating packs. We use ultrasound. We use electric stim.
Yes.
Where you put the pads on and actually make the muscle contract and relax to try and put it into a relaxed state, or to
Right.
try and get the nerves calmed down, or to get the pain, help reduction of pain.
So you want to reduce that pain first for them? Sure.
Exactly.
Okay.
We'll use cryotherapy a lot. We use a lot of ice.
Right.
And a lot of times in people ask you, what do I do? I have
An injury.
I sprained my ankle.
Yeah.
Or and ice is a key.
Right.
We use the axiom RICE, which
Okay.
stands for RICE. RICE is for rest, ice for ice, C is for compression,
Yes.
and E for elevation.
Okay.
So RICE is a key word. Rest, ice,
So that's how
compression,
everyone can
elevation.
remember that. If they have an
Right.
immediate injury, immediately afterward.
Immediately after it's RICE, and it's for 24 to 48 hours. We really would stay with that program.
Right.
Obviously
Before
if it-
bringing heat into the program.
before bringing any heat into it.
Okay.
Because if it's a muscle or a ligament or a tendon, you have tearing, you have bleeding, you have a swelling or edema.
So a lot of people
So-
may not understand that. I mean, you don't want a lot of
Yeah.
people after they hurt their back or so, or hurt their knee, they immediately want to put a heating pad
No,
on or put heat
that's
on it.
right.
And they
it's-
sell heat packs that I know about, and they put those
Exactly.
guys. But that's a wrong.
That's absolutely the wrong
approach,
thing.
is that right?
You would want to use ice at least for the 48 hours.
Okay.
And that's strictly ice, compression, elevation. and rest.
And that's it.
And that's it.
Okay.
And that's it. And then you may want to start introducing some heat. But it depends, of course, and of course we're just talking in general here.
Yes.
Anything that you may have, you may need to see a doctor. You may
Yes.
need to go to the hospital. We're just,
Right.
You're
the first line of defense, first
right.
line there.
That's
okay.
right.
And you guys make that decision, right? I mean, one of the thoughts is when do you know when to call in the medical doctor?
Exactly.
So
we're very fortunate with the Yankees because we have an orthopedic doctor at every single game.
Okay.
So it's not even a matter of calling him in. He's there.
Right.
So we're very fortunate that way.
And he's at every game, so you need him, you just call him and he's there.
That's right.
Okay,
yes,
so you have a good support system.
We have a great support system
in around the stadium.
Well, we have a great support staff. I mean, we first of all, starting with our coaches.
Right.
Joe Torre, it's hard to get any better than him. I know you've worked on Joe, and he's a patient of yours, and he's outstanding. And then we have Larry Boa and Tony Pena and Don Mattingly.
Right.
Ron Guidry, who we know. Ron
Yes.
Guidry, he's a funny guy. Let me tell you a story about Ron Guidry.
Go ahead.
He's from Louisiana.
Yes.
Louisiana Lightning was his nickname as a pitcher, a left-handed pitcher for the
Right.
Yankees. And so I was talking to Ron this year, and I said, Ronnie, all these years you've been with the Yankees and in the Bronx, have you ever gone to the Bronx Zoo? And he said, no, I've never been to the Bronx Zoo. He said, I work there. Why would I want to be there? I said, well, I know that, but I said, really, at the Bronx Zoo, on every cage, there's a picture of the animal,
Right.
and then the name of the animal,
Yes.
and then the name of the animal in Latin. And he said, in Louisiana, in the zoo, every
Yep.
cage has a picture of the animal, the name of the animal, and then a recipe for the animal.
He's a funny guy.
He's great. He's great. But our support staff, we have obviously a lot of health support too. We have a massage therapist that's
Yes.
with us every day, and he
Yep.
travels with us.
Right.
We have a strength and conditioning coach.
Okay.
Who actually works with the players, as far as all the conditioning, cardiovascular, strength training, and flexibility.
Mm-hmm.
And then
He travels with the team.
He travels with the team as well. Okay. And then of course we have our orthopedic and our doctors, and then we have our allied doctors who, like you, when we have a player, we have a problem with his spine, we send him over to Dr. Bozzoni's to your either White Plains or Somers office,
Right.
and
in conjunction we try and
we
help
try
these plays.
Everybody tries to work together and be on the same page and communicate, and it really has worked well for us.
That's great. That's great. You get these guys on the field back as soon as they can.
Exactly.
So what's the toughest aspect of being an athletic trainer?
I'd say the toughest aspect is probably my family. My family, not being able to be around my family as much as I need to be or want to be.
Yes.
I have a couple young girls, and we play every day.
Yes.
So if there's a graduation or a birthday party or a 4th of July picnic,
Right.
it doesn't matter. The Yankees, they're going to play the game, and I have to be there. So
you have to be there.
So that's a little tough, sometimes, but they're great about it. My wife and kids are great. They're very understanding, and they've grown up with it, so they
don't know anything
it,
else.
But that's right. They don't know any better, but it's the tough part sometimes.
Yeah. And is there a certain time of year that's really harder on you than
spring
other
training
times?
is probably the toughest time.
Spring
training because there's so many more players than normal.
Yes.
And we have 25 players and 6 coaches.
Right.
In spring training, we may have 70 players.
70.
And we could have 20 coaches or maybe more. We bring a lot of coaches down to spring training. We're very good as an organization about bringing in players. We bring in a lot of celebrity players, guys
Yes.
that don't normally coach for a living, but that will help our young players. And it's good for the players because they get to meet and see a Reggie Jackson, and he'll talk to them about what it's like to hit in the World Series and what it's like to hit in those, or Goose Gossage, or Greg Nettles, or Yogi Berra. I mean, we really do.
Just being around these guys
and stuff. Yeah, it's just great. Just to rub shoulders with those guys for these young players. It's really something that a lot of organizations don't have and do.
Right.
I mean, you know what they say? The difference between a Yankee hot dog and a Wrigley Field hot dog is
what is it?
You can buy a hot dog in Yankee Stadium in October. That's the difference.
That's great. And you have many of those Octobers, huh, Steve, with those 4 rings?
We sure hope.
Okay. So let's talk about some of the injuries that could happen. And in baseball, what are some of the common injuries?
The most common injuries in baseball, unlike football where you have a lot of trauma and you have a lot of contusions and bruises and dislocations and fractures, in baseball it's a lot more overuse injuries.
Yes.
The body's not made to throw overhand and not made to throw 100 pitches at 90 miles an hour or more. So we get a lot of the tendinitis, the bursitis.
What is a tendinitis?
Well, tendinitis is when the muscle comes. Let's say the bicep muscle comes into a tendon, which is between the muscle and the bone. The tendon is what attaches the muscle to the bone. Okay. So a tendinitis is inflammation of that tendon.
Okay.
So if you have bicep tendinitis,
yes,
that's where it is. It's between the muscle, the bicep muscle, and the humerus bone, the tendon there.
Okay, so it's a tendon gets inflamed.
Tendinitis. The tendon gets inflamed.
Yep.
And so we get a lot more of the tendinitises, the bursitis. Burst is a sac in the joints,
yes,
and all your joints have sacs that lubricate the joints.
Right.
Those sacs get inflamed, and you get a bursitis.
Okay.
So for the throwing athletes,
right,
which all our players throw, but particularly the pitchers.
Pitchers, right.
You get a lot of shoulder and elbow tendinitis,
sure,
bursitis. With our catchers, and in the squatting position, you get a lot more knee injuries, knee tendinitises,
sure,
and backs.
Okay.
So
that's what we're seeing. You see a lot of those more so than
more overuse injuries than we see trauma injuries. So a lot of it is non-steroidal anti-inflammatories that the doctors prescribe.
Right.
And a lot of treatment, a lot of heat, and before we our big thing for us is to heat a player up and get them warm and loose before the game, and then ice it down after the game. So. Right. What you want to do is you want to get these joints or muscles warmed up before the game. Yes. So we artificially warm them up with hot packs or analgesics and massages and ultrasound or stim,
right,
and then get them on the field early so they can warm up, do their running, get loose, play catch.
Yes.
So they're internally warmed up, they're externally warmed up, internally warmed up, and then they play the game.
They're ready to go.
And as soon as the game's over, because the muscle is used so much,
yes,
and there's micro trauma to it,
yes,
then we ice them down to try and reduce any of that swelling, keep everything
right,
and the bleeding from happening.
Yes.
And so
get them ready for the next game, which is probably tomorrow.
That's right.
Right?
That's right. The next
I mean, not much time to do all the healing, do we?
162 games and not very long, but
that's a lot of games, and it's a lot of time on your part. I mean,
sure
even when you're away from the season, you're down at the stadium often doing work on these players who rehab from surgeries they may have outside of Yankee worlds. Is that true?
That's true. Well, in other words, it's not just a seasonal job. It's a 12-month job as an athletic trainer with the team. Right. It's you go from we'll start in February,
right?
Early February, the first week we'll go to we'll go to Florida, right, and start setting up for spring training.
Yes.
Our physicals, I think, for pitchers and catchers are right around February 14th.
Okay.
So right around Valentine's Day, pitchers and catchers will come in.
Right.
And then about 5 days later, the position players come in. We get the pitchers and catchers about 5 days ahead of the position players to get their arms ready.
Yes.
And then so then 5 days later we have physicals again, but for just position players.
Right.
And then we go the rest of February and March playing. Then we come up north in April.
Right.
And the games start around April 1st.
Yep.
And then we'll go hopefully through late October.
Yes.
Which is the plan.
Right.
Always
the plan.
Always
the
plan.
Goal. That's the goal for the year.
And then when we're done with that, then November, December, January, any kind of surgeries we have, any kind of postseason or anything that we have to do, we rehab, and then it's a matter of inventory and checking on prospective players that we may be drafting or maybe trying to make a deal for.
Yes.
Trying to figure out our team for the next year.
Right.
And then it's, like I said,
so
inventory, packing for spring training, getting all our ordering in and getting everything done. So it's 12 months.
Oh,
yeah,
wow.
we go.
It's a challenging schedule.
Yes, sir.
Thank God. Okay. When the player gets hurt, isn't there a lot of communication that has to take place between the manager and between like the Joe Torre and Brian Cashman and those
communication
guys?
Communication is key. Mm-hmm. Between, like you said, between the manager, the general manager, and the coaches. Yep. Everybody has to be on the same page.
Right.
So usually on the road, the general manager doesn't travel with us. So between our computer, we have medical programs set up, so he can look up everybody that got treated the night before and what their injury or complaint was, and what they got and what they able or unable, and of course we're talking with Joe and the coaches all the time. So between the cell phones and just being in the dugout with them, obviously, and the computer back to New York or wherever we are.
And Joe makes that final decision, does he?
Joe does make the final.
Okay,
Joe's great.
I feel great. I'm the player. I feel great. But Steve Donohue says, no, you're not great yet. Joe makes a decision based on that. He's going to listen.
Yes, sir. Joe's great. He's always going to try and side on caution because these players, they all want to play. I mean,
Sure.
this is their job. They all want to be out there. They all want to be contributing, and that's what makes the success of a great team, because everybody wants to contribute.
Yes.
But sometimes moderation is the better part of valor, and so we have to. Sometimes they need a day off. I mean, Hideki Matsui is a prime example of somebody who had a record of consecutive games going back to his Japanese time. I mean, he's like the Cal Ripken Jr. He was an Iron Man.
Yes.
And at the point where you could see he was very fatigued.
Yes.
But because of this record, he wanted to play. He wanted to play. But I won't say luckily, but now since his wrist fracture this year,
Right.
that consecutive games are over.
Right.
And so
So it made some good out of that.
if there's a silver lining to that cloud, then that would be the only one I can find. But
Okay, great. Well, we look forward to having him back too.
yeah.
Okay. I look in the dugout sometimes, Steve, and you're there, and all of a sudden a player will get hurt on the field, and you're darting out onto the field. First of all, what goes through your mind? I mean, there's so much at stake, especially if it's a playoff game or World Series game. There's so much at stake with the player, financially, and for the career of that player, and for the team's success.
Right.
Knowing whether to take the player out or not. What goes through your mind?
That's right. Well, first of all, when you're sitting there, you have to kind of have an idea of what's going on with the game,
Yes.
and where the game is going, what particular player, where the injury could occur.
Right.
Because you want to see the mechanism of injury. Because that'll help you before you even get to the player.
Sure.
If you have an idea what happened.
Right.
So you're trying to keep aware of what's going on the field and what's happening. And then as you go out there, you really can't think of the financial aspect. I mean, I try not to think of the financial aspect at any time, because if a player comes in with whatever it is, I don't want to be I can't be thinking about this guy's making this much versus one of the other guys. But and you're right, because you don't want to take a key player out of the game, but you really can't think that way. It's got to be based strictly on the anatomy and the injury. And so when you go out there, first thing is always first aid.
Yes.
Obviously you're looking for making sure he's, airway, breathing, circulation, everything's fine that way.
Right.
Then when you get to the actual injury itself, if it's a limb, or if it's a knee or an ankle or a shoulder or an elbow, you're looking to see range of motion.
Right.
Does he have a complete range of motion? Right. Then you're going to check his strength. Is he strong? Is he got the same strength in both sides?
Yes.
You check him bilaterally. Is a guy if it's an elbow or a wrist, is his grip as strong on the left as the right?
Okay.
Has he got the full range of motion? Can he do what he's supposed to do? And then, of course, the main thing is the pain.
Right.
If his pain tolerance, can he continue to play like this?
Right.
And
Is he
then
going to still contribute to the team?
and
or is
still
he gonna,
contribute, yeah. Because if you put somebody out there and then you go back and sit down in the dugout and the next ball is hit to him and he can't make the play, then
I know a lot of people Monday morning quarterbacks on it. So why did they put him back?
Yeah.
Why didn't he put him back?
Exactly.
So I mean, you guys have a lot on your shoulders at that point,
That's
and
true.
make that decision.
That's true, and of course, there's millions of people Monday morning quarterbacks there.
That's
so.
right.
But Joe's great about it, and like I said, when Joe will come out, and he always decides on the side of caution, so it really helps that way too. He'll take the even though the player will be pleading to play, he'll take the onus off and say, no, it's time.
Right, because everybody's pain tolerance is going to be different.
That's true. Absolutely different.
We know we have Andy Pettit coming back now,
Andy
right?
Pettit's coming back.
We're looking forward to that,
Yeah,
right?
that's great. We're looking
guy.
forward to seeing him. He's wonderful. He's super, and he's had some elbow issues in the past, but I'm really looking forward to having Andy back. He's always been a great friend. So
great. And Steve, what would you recommend if some of our viewers out there would have interest in becoming an athletic trainer? Students, kids?
I would say you want to be strong in the sciences. You'd want to really work on your sciences.
In college, we're talking?
In high school, going into college, biology, obviously, anatomy, biology, all the sciences, to try and work almost towards that pre-med physical therapy, that degree. And a lot of colleges now are offering sports medicine as a major.
Yes.
So I would say, you may want to do some volunteer work in a hospital, in a PT department, clinics. I think that's the kind of way I would.
You have to have a love for learning about the body.
Yeah, you have to.
Right. I mean, that's really the key, isn't it?
Yeah, you have to want to help. You have to want to help people get better.
Yeah.
And whichever way you want to do it, whether it's as a physician or a doctor or a trainer or.
Yep.
I think that's the
key
but
right
the sciences are key. The sciences, and then maybe working or volunteering at the high school level.
Right.
Seeing what that's like, you know.
Okay, and watching these other trainers do what they do, make sure it's something you really want to do.
Exactly.
Yeah.
Exactly.
So any last words, Steve, before we close here today?
Go Yankees.
Go Yankees. You are another great season.
Yeah.
And just want to tell our viewers that if you have any questions for Steve Donohue or for myself, you can go to our website and email us, and we will get those questions off to Steve, and he'll do his best to get those questions answered. If there are any students out there who have any interest in going further, please give us an email. And I want to just remind you that our next show is going to be on cosmetic and facial plastic surgery, so I'd like you to tune into that, and that'll be on Thursday evening. So thank you again, and thank you so much, Steve, for being with us. It's been a real pleasure.
Appreciate that. Thank you very much.
Okay.